at the Maternal and Child Health Bureau, Health Resources and Services Administration. So the Division of Research provides ongoing support for maternal and child health, or MCH, extramural research activities, including the Engaging Research Innovations and Challenges, or the EnRICH webinar series. So today you're joining a community of more than 200 participants with an interest in advancing MCH research. The EnRICH webinar series provides technical assistance and updates aimed at stimulating interest in applied and translational MCH research. So today's webinar is entitled Research Grant Writing Basics in MCHB, OER, DOR, Grant Proposal Overview, Exemplary Tips, and Examples. Today's presentation is the first of a series that will focus on MCHB, OER, DOR grants. So before we start today, I'd like to introduce today's speaker, Dr. Eva Assing-Murray. So Dr. Eva Assing-Murray is a project officer and senior health scientist in MCHB's Division of Research. She holds a PhD in sociology and is also an adjunct lecturer at Montgomery College. Her research focuses on systemic barriers to quality health care for underserved and marginalized MCH populations. Dr. Assing-Murray has extensive project officer experience and has monitored federally qualified health centers and HRSA's Bureau of Primary Health Care for 7 years, and also steered autism and MCH research investments in MCHB's Division of Research for over 3 years. So now, please take a moment to ensure everyone in the audience is ready and comfortable with our technical aspects of the webinar. I'll now turn this over to Kara Wise from the MCH Workforce Performance Center at Alterum to walk you through the webinar interface, including how to submit questions and other technical information.
Thank you, Dana. So in this webinar room, there are several sectioned areas. The largest holds the slide presentation. You may enlarge it to full screen by selecting the icon in the top right. Keep in mind that this hides all other areas until you select the icon again to return. If you have any questions or comments during the presentation, please enter them into the Q&A area. They will be sent directly to the moderator, and we will attempt to address all questions during the Q&A session after the presentation. And I'll turn it back over to Dana.
Thank you, Kara. So next, we'd like to quickly gauge the audience on research grant writing. So on your screen, you will shortly see one poll question. So please go ahead and rate your current knowledge of research grant writing, with 1 being limited and 5 being high. Right, so it looks like we have folks that have a very high level of knowledge in the area and others who are looking forward to learning something new from the program today. So thank you for your participation in the poll. So I'm now going to turn the program over to Dr. Assing-Murray.
Thank you, Dana, for that warm introduction. Hello, everyone. We in the Division of Research are very excited that you've decided to join us for this first of a series of planned grant writing webinars. And this webinar incorporates material presented by Drs. Michael A. Sesma and Roger G. Sorensen, both from NIH, in a webinar entitled Grant Writing for Success. And we were granted permission by Drs. Sesma and Sorensen to adapt their content to our training needs. So today I will provide a brief overview of HRSA, MCHB, OER, and DOR. I promise I will spell out these acronyms. I'll also provide guidance on accessing grant opportunities in DOR and tips on writing strong grant applications and select reviewer comments drawn from winning and low-scoring applications. I will also leave some time at the end for questions. So HRSA is the primary federal agency focused on improving healthcare for geographically isolated, economically or medically vulnerable populations. Our programs assist those in need of high-quality primary healthcare, people with HIV/AIDS, pregnant women and mothers, and the training of health professionals. MCHB's mission is to improve the health and well-being of America's mothers, children, and families by envisioning an America where all mothers, children, and families are thriving and reach their full potential. Our programs serve more than 50 million women, children, and families each year, including half of all pregnant women and 1/3 of all infants and children in the U.S. And we rely on evidence-based strategies and are data-driven. The Office of Epidemiology and Research, or OER as it's called, supports and conducts maternal and child health research by providing national leadership around the development, advancement, and utilization of scientific knowledge. OER supports maternal and child health research that informs practice and policy that will promote health and prevent disease among women, children, and families. OER comprises the Division of Epidemiology, which oversees MCHB intramural research program, and the Division of Research, where we're from, which funds extramural research. The Division of Research, or DOR, provides leadership and funding that supports innovative research which informs practitioners, the scientific community, and the public, and help advance the MCH field. The 4 broad grant competitions that we support in DOR include, and this is a very important slide, and for those of you who are new to our programs, this really is the most informative because it really lays it out across the MCH and the autism-focused grants, all that we have to offer, all of our 4 different programs. So these 4 broad grant competitions are, and by order of the level of investment, the Research Network Program, the Field-Initiated Innovative Research Studies Program, known as the FIRST grants, the Secondary Data Analysis Research Studies Program, known as SDAR grants, the Single Investigator Innovation Program, or SIP. Roughly half of our portfolio has a broad MCH focus, while the other half is focused on autism. And decisions on what, how many, and at what level to fund is driven by Bureau leadership. There are many conversations that take place across various offices and divisions within the Bureau to identify gaps in research, emerging priorities, and of course, funds for specific research initiatives and priorities every fiscal year. Once these decisions are made, funding opportunities, or NOFOs as they're known, are then drafted and posted on the HRSA website and grants.gov. Typically, you have 90 days to respond once a NOFO is released. And the NOFO will be the primary reference document for applicants, as they incorporate all substantive grant provisions such as application requirements, evaluation criteria, and selection procedures. And you must apply via grants.gov. I'd like to spend a few minutes walking you through the process of applying for HRSA grants, specifically our research grants in DOR. You can search via the HRSA.gov website or go directly in grants.gov where you can search MCHB and get information on open or forecasted opportunities. So on the HRSA website, you would select grants highlighted here with the red arrow. And once in grants, you would then do a find funding search. And this search will take you to all of HRSA's funding opportunities. So using the pull-down menu, View Funding, you can narrow your search to funding opportunities that are currently open and within the Maternal and Child Health Bureau. And when you hit search, it will show you what's currently available in the Bureau. You'll see things like the title of the funding, the announcement number, status, and the application deadline. And when you select a funding opportunity that you want to learn more about, it would look like this. So here again, you'll see a summary of the program you'd be applying for, the announcement number, application and award dates, contact information, and a link to the NOFO to apply shown there by the red arrow. You can also find a funding opportunity directly in grants.gov and find up 4 alerts once you've found one that you're interested in applying for. And you should search under Search Grants, highlighted here, where you would type MCHB. Open and forecasted opportunities will appear, and you'll follow the link for further guidance on applying. There are also tutorials and other resources on applying under the tab right next to the Search Grant tab called Applicants. So before you start to write, so at this stage, you've identified the grant competition that you're interested in. You know the application mechanism is through grants.gov. I recognize that we have a mixed group of participants attending this webinar. So if you are early career or new to the grant application process, it might be overwhelming knowing what to do next, especially given that you have a very short 90-day window to apply once the NOFO is released. So a good place to start is to carefully read the instructions in HRSA's SF 424 R&R application guide. Now, this may seem like an obvious step, but we often receive questions from applicants that are already addressed in great detail in this guide, indicating to us that some potential applicants are not reading the guide carefully. And it's a really important step that you don't want to miss. And so for those of you who are not familiar with this document, the SF 424 R&R application guide is specific to HRSA's research and training funding opportunities. The purpose of this document is to provide detailed instructions to help you prepare and submit your applications electronically through HRSA, through grants.gov. Another obvious yet important tip to keep in mind at this early stage is to propose research that you are passionate about and committed to doing, as you'll be far more successful researching a topic you're interested in than not, especially if you're early in your research career. Of course, passion is only one factor in choosing a research topic. Another necessary ingredient is commitment or drive to see it through. So some pre-writing activities I'd like to recommend are to develop a pre-submission planning timeline, understand the HRSA MCHB mission, understand the peer review process, secure collaborators or mentors to complement your expertise and experience, and learn the skills of writing applications for grant funds. Based on our 90-day grant application window, this pre-submission planning timeline shown here on this slide is but one example of how you can plan in a very simple way, or as you can make this as detailed as you like, so you can track your progress to submission. Your times allotted to the various phases may vary based on the resources available to you and your level of experience applying for grants. However you decide to break up the phases, you should consider building in time to plan, write, and submit. During the planning phase, some activities you might cover are accessing your capabilities, the field, and your resources, identifying potential collaborators for your project, and researching your idea. During the writing phase, you'd draft an outline, you'd write your application, solicit feedback from trusted sources, revise, and most importantly, proofread. During the submission phase, you'd ensure you have everything you need to submit and meet institutional deadlines in grants.gov. And that information would be in the SF424 guide as well as the NOFO. So I'd recommend that you not wait until last minute to submit, as invariably folks experience system issues or glitches or realize that the application is incomplete, etc. So whatever you do, build enough time in for the unexpected. As you develop your good research idea, you want to ensure that it is aligned with the agency's and Bureau's mission. This is an important step. Be sure you understand what they are. The information is available on the internet at HRSA.gov. Simply, our mission at HRSA is to improve health outcomes and achieve health equity through access to quality services, a skilled health workforce, and innovative high-value programs. Here is the MCHB strategic plan, and applications are expected to demonstrate alignment with one or more of the MCHB strategic goals listed here. So as you think about your resources in this pre-writing stage, you want to consider potential collaborators or mentors who can complement your team. One approach that more experienced investigators use is to collaborate with their competitors and bring them into the proposed project. Why not? It's a win-win strategy for everyone. They don't compete, they collaborate. So collaborations are also strongly encouraged in our NOFOs, more now than ever. For early-stage investigators, having more seasoned investigators on your team lends strength to your application and helps you build your grant writing and research skills. Understanding how the peer review process works gives you an advantage when beginning to write your applications. Remember, reviewers are there to simply provide an assessment of the material that you provided in your application. So you want to approach this process with the goal of convincing an entire committee of your peers that your proposed research will be of high impact and feasible, and whatever you do, don't take that feedback personally. You want to clearly demonstrate the impact and significance of your project throughout the application, but you also want to remove all distractions, as the reviewers will review many applications. Grant reviewers often have different research experience and training than you do, the applicant. Therefore, you want to give them a basic understanding of what you're proposing while giving them enough detail to indicate mastery, should the reviewer be an expert on the topic. So to that end, you want your application to be both easy to read and easy to understand. You also want to ensure that your application is free of spelling and grammatical errors. One tip to truly understand the peer review process is to become one yourself, a reviewer. Consider registering to become a HRSA reviewer. That way, you get exposed to our various grants and our peer review process. You will provide, so you should have some guidance later on in this presentation or perhaps in the chat box where you can get some information on registering to become a HRSA grant reviewer. So as you get ready to write, keep in mind a few things. That grant writing is a learned skill. Writing grant applications that get approved are learned skills, just like writing manuscripts that get published in peer-reviewed journals is a learned skill. Draftsmanship is also a full-time job for some, and you're being asked to do this along with everything else that you're doing as a researcher. So spend time early in the process learning how to write strong grant applications. There are tons of free resources on the internet. Our sister agency, NIH's Office of Extramural Research, has a lot of material on the topic, and also attending webinars, etc., as you are here. So at this stage of preparing to write, you should have already read your application guide instructions and NOFO carefully, so you know exactly what you need in order to complete and successfully submit an application. As you draft your narrative, there is guidance in the NOFO on the narrative headings and subheadings you should be using to frame your application. You also want to keep in mind the criteria that the reviewers will be using to score your application. And these are outlined in the NOFO. And we've included a table in every NOFO that provides a crosswalk between the narrative sections and where each section falls within the review criteria. And here is a table drawn from a first NOFO, and the first is the Field-Initiated Innovative Research Studies Program. We will be using the first NOFO as our example for the next few slides on the 7 criteria reviewers use to evaluate and score the merit of the application. And as you can see, each criterion is between 5 to 30 points, totaling 100. As reviewers read through the various sections of the application that address need, they will be looking closely for evidence that your proposed study addresses an important problem. You've clearly stated the characteristics of the target population, and your proposed project is aligned with HRSA MCHB strategic goals, HHS HRSA clinical priorities, and healthy people objectives. For this response criterion, reviewers are scoring the related sections of your narrative based on your ability to implement what you've proposed in the needs section. Specifically, reviewers want to see that you've clearly demonstrated your knowledge of previous or current work conducted in the area, clearly specified the hypothesis, variables, and goals, and they are linked to the previous needs section, clearly established the relevance of the proposed project to the field. For scoring evaluative measures, reviewers want to see evidence that your conceptual framework, design, methods, and analyses are well developed, well integrated, and appropriate to the aims of the project, and that you have considered potential barriers and solutions. For the impact criterion, reviewers are paying close attention to whether the proposed project and its stated aims are original and innovative. And this is a requirement for the first program, as I'm using this as an example, and that you've clearly and thoroughly described your plan to transfer findings to practice. For resources and capabilities criterion, reviewers are taking into consideration the level of skill and training of the team to conduct work if they complement each other, and the likelihood that the project will be successfully implemented based on the resources available to the PI and the team. In this support requested criterion, reviewers are reading closely to determine whether your proposed budget is reasonable and sufficient in terms of time allocated to key personnel and costs to conduct the proposed work, and that you've clearly identified and justified the budget line items. Finally, in program assurances criterion, reviewers are interested in whether the proposed timeline is clear and feasible, whether there are adequate protections in place for human subjects and maintaining the security of the data, and a plan for targeted enrollment, ensuring diversity of the participant pool, etc. So at this stage, you found a funding opportunity that you'd like to apply to. You've done your homework and researched the mission, vision of the agency bureau. You've read the application guide carefully and the notice of funding opportunity. You have drafted a timeline for completion. You've also started to think about some feasible projects that get you excited and line up collaborators to complement your team. But there are also other factors that you need to consider when deciding on a project, as you will have to address these questions in the narrative. Does it address an important problem gap in the field? Does it advance the scientific knowledge? Does it build upon or expand current knowledge? Is it feasible to implement and investigate? Based on our experience of sitting on a number of review panels, and some of us serving as reviewers across HRSA and other federal agencies, we can say that proposals that get funded have the following in common: high impact, strong significance to an important public health issue, high degree of novelty and innovation, strong track record by a well-qualified applicant and team, clear rationale, clear and focused approach that provides unambiguous results, careful attention to details, spelling, punctuation, grammar, fonts, clarity of data, etc., that do not distract from the substance. Inversely, these are some of the more frequently cited reasons for a weak application: weak impact, significance unsupported, too ambitious or lacking focus, unclear or flawed hypothesis or rationale, applicant track record weak or lacking appropriate expertise, feasibility unsupported, approach flawed, poor writing. One tip to consider when drafting your application is to get feedback from a colleague. Provide enough information so they can give you valuable feedback, such as what you intend to do, why you believe it is important to do, exactly how you are going to do it, and take the feedback seriously. Revise and build enough time in for that revision. In this section, we'll be talking about funding decisions, specifically what determines which applications are funded. There are a number of factors, and they don't all have to do with the strength of your application. Scientific merit and impact is one factor. Is your research design and methodology sound and likely to contribute to the literature, discipline, or field? Program considerations and availability of funds are other factors, as bureau leadership and program determine how many applications we can fund in a fiscal year. While we typically list the number we intend to fund in the NOFO, we can't always predict the level of funding we will actually get from one fiscal year to the next. So after peer review, you or your authorized official will be notified prior to the project start date whether you were successful or not. If you were successful, congratulations. You will be required to submit responses to the summary statement, and your project officer will guide you in that process. If you are not successful, however, don't get discouraged. Closely review the summary statement, share what the reviewers said about your application with your peers for their feedback, and try again. Remember in an earlier slide, I said that there are many factors that determine who gets funded, and not all are based on scientific merit. So please keep this in mind. One of our objectives for designing this webinar is to give you tips and examples specific to our program that can help you write strong applications and avoid some common mistakes that we see time and time again. Here are the top 5 reviewer concerns. First, there is not a clear hypothesis or well-defined goals. To avoid this mistake, be sure to provide a focused hypothesis and objective. Describe the importance and relevance of your problem. Be clear on how your project will move the field forward. The second common reviewer concern is that specific aims do not test the hypothesis, or the specific aims depend on results from previous aims. As you know, specific aims are like your sales pitch for planned science. They demonstrate a problem, a gap in current knowledge, and suggest a solution. So you are proposing aims that work toward a defended solution and reveal the impact of the proposal on the problem, the field, and future research. So the best proposals are those with independent specific aims that are central to your hypothesis and problem. And avoid aim dependency, where one aim cannot be completed if the other one fails. The third reviewer concern is the proposal is overly ambitious given the project period, funding level of experience of the research team, access to data, potential barriers, etc., and deemed unlikely to be successfully implemented. The fourth top reviewer concern in our experience is related to the prior concern about being overly ambitious, as similar factors are considered here. The experience of the team conducting what was proposed, the resources it will take to implement, etc. So our guidance is to propose what you can actually do. Include collaborators and consultants on your project who can complement your experience and resources. Describe the value of data sets and innovative models you've proposed. The final reviewer concern that I wanted to highlight is the background section, missing key publications. So you want to ensure that you're thoroughly describing the literature, that you didn't miss any key references, and the ones you've included are the most current, unless, of course, they're landmark studies. Another objective of ours for this webinar is to provide you with actual examples of reviewer comments taken from strong and weak applications across our programs. So earlier, I discussed more broadly what reviewers look for when assessing your application for each of the 7 review criterion. In the next few slides, I will share select summary statements, real summary statements, from both winning and low-scoring applications for comparison. So for review criteria needs, these are some real comments that applicants received. Noted strengths were that applicants clearly described the unmet health needs of the targeted population, clearly described barriers and characteristics of the underserved study population. For weaknesses, reviewers noted that it was unclear whether the proposed study addresses an important problem. Applicant did not provide a justification of unmet need, and statements related to the theoretical model were not supported by the relevant literature. For review criteria response, a strength identified from a winning application is on planned collaboration with partners to address the need of underserved population. Some weaknesses identified are that applicants didn't clearly demonstrate knowledge of previous or current work conducted in this proposed area, and the proposed project's relevance or significance to the field was unsupported. Applicants also didn't clearly and concisely describe and link hypotheses, variables, goals, and objectives, and their relationship to the proposed project identified in the needs section. For this criterion evaluative measures, reviewers are also looking closely at your proposed plan and methods for conducting the work and scoring you based on whether they're appropriate, well-developed, feasible, and robust. They're also scoring you on how well you've considered potential problems and ways to address them. This might become even more important in times when we're conducting research during public health crises such as COVID-19. For strengths, a reviewer noted that the application describes a comprehensive, detailed plan for diverse dissemination strategies to professional audiences, families, and communities using multiple modalities. For weaknesses, reviewers noted that the sampling design and rationale for the study design are not provided. Threats to validity are not discussed. Procedures for recruitment, data collection, analyses are not described. For this criterion impact, reviewers will be assessing your application on how well the expected outcomes are likely to have an impact on healthcare delivery strategies involved. They would also be assessing you on how well the problem addressed by the proposed research and the results will have broad public health impact. The strengths identified from this winning application are the inclusion of autistic individuals on advisory groups and meetings, increases community engagement. A reviewer also highlighted the applicant's record of publication and the likelihood of meeting its publication requirements. Weakness identified in a low-scoring application is no history of publications in the field, instrument development, or clinical practice. The applicant did not provide a conceptual framework or a publication and dissemination plan. The applicant did not clearly describe how to shift practice and advance knowledge in the field. For resources and capabilities criterion, reviewers will be scoring your application based on the capabilities of the applicant organization, the quality and availability of facilities and personnel to meet the needs and requirements of the proposed research project. So really looking at the supports you have in place. For strengths in a winning application, it was noted that the personnel are all a strong group of investigators who have experience working together. The team is well established with extensive experience. Weaknesses identified in a low-scoring application include a description of facilities and resources or detailed information about the organizational capacity were not provided. For support requested criterion, reviewers are looking throughout the narrative for evidence of the reasonableness of the proposed budget in relation to the objectives, the complexity of the research activities, and the anticipated results. A noted strength in a winning application is the investigator and research team costs are viable and match the work to be accomplished. Noted weaknesses in a low-scoring application or funds or budget items are not clearly described or justified. The PI and co-PI do not have cover time and do not specify effort provided in kind, among others. Finally, for program assurances, reviewers are looking for evidence that the timeline is clear and feasible to implement the project and that the applicant demonstrates the feasibility of reaching targeted and planned enrollment levels, and that adequate protections are afforded to human subjects and data, etc. Noted strengths were that the org chart is impressive and visually organizes the effort in terms of leadership, ownership, and accountability, and the application demonstrates feasibility of reaching planned enrollment. Cited weaknesses were the application does not provide a timeline, the application does not address cultural competence, does not provide detail about planned enrollment and strategies to achieve targeted enrollment, does not describe a plan for the protection of human subjects and data security. So I mentioned earlier that one way to familiarize yourself with our grants and review process is to consider becoming a HRSA grant reviewer. So currently, MCHB does not employ standing review committees. All scientific review committees are ad hoc, with changing membership based on the needs of a particular NOFO. So when serving as an ad hoc reviewer, each panel member may review up to 6 grants, and we offer an honorarium for your time. We do ask that all reviewers are doctorally prepared, have some experience as a PI or in the administration of research grants or programs, and have first authored publications in the field. Please keep in mind that reviewer participation counts toward investigator experience, and this is a creditable activity on your grant application. However, you must register in advance in grants.gov, and our Division of Independent Review, DIR, will select reviewers to serve based on whether you meet the selection criteria for that particular funding opportunity. So I know we have covered a lot of material in the last 40 minutes or so, but I wanted to recap the key points so you can be successful in competing for our funding in the Division of Research. Sign up to our Division of Research listserv. Start your planning early. Understand the agency's mission. Understand the peer review process. Secure collaborators or mentors to complement your team. Read the application instructions carefully. Consider becoming a HRSA reviewer. Don't be discouraged if you are not successful the first time. Review the summary statements carefully, get advice, regroup. Reach out to program officers if you have questions on program-related issues, grant-related issues. You can reach out to the grant management specialist. Each NOFO has both names listed on there. And attend future EnRICH webinars on the topic and review this webinar, which will be archived for a refresher. So on this slide is my contact information. And finally, here are ways to connect with HRSA on 4 social media platforms. And at this stage, I will turn it back over to Dana to take questions.
Wonderful. So thank you so much for sharing such great tips and strategies for effective grant writing. We really appreciate you taking the time to share your expertise with the MCH community. So we are now ready for the question and answer period. Kara, could you please remind the audience how they can submit questions?
Yes, so you can make sure that your slide presentation area is not set to full screen so that you can see the question and answer area. Just enter a question or comment by typing that into the question and answer box, and it will be sent directly to us.
Thank you. We'll just give folks a moment. Okay, so I will start by asking the first question. Do you offer any grants that are better suited for early career researchers who may not have experience being a primary investigator?
Okay. So we don't currently have a program tailored towards emerging researchers and their needs. But of our 4 programs that I described in an early slide today, the SDARS, I believe, would be a good entry point for someone looking to get that experience. And I say they're well suited to emerging researchers because they're 1-year grants at $100,000. And so the SDAR program, what it is, it supports applied research on critical and emerging MCH or autism issues using national databases and or administrative records and that are already existing and publicly available and accessible. And this is really the key here. They're already existing and are accessible and available because you only just have 1 year in order to implement your project. So what this does, it gives you, the opportunity to perhaps pose new research questions, test new hypotheses, determine the feasibility of interventions using data sets that are already existing rather than conducting your own primary research, which can be costly and time-consuming. So it's really low cost, low time, and opportunity, and I think it will be a good first start into our, suite of programs that we offer.
Thank you. So this one is related. So what kinds of data sets can you use for the SDARS?
Well, data, you have a choice of whatever you want to use. We don't specify that you have to use one or the other. It's, national databases, administrative records, any of those things that you have access to that are existing and available and accessible to you.
Thank you. Okay. So who is eligible to apply for a DOR grant?
Okay. So eligibility for our funding is defined in each NOFO. But in general, only domestic institutions that meet the eligibility criteria can apply. So domestic, that's the key. So this includes public, private, nonprofit entities, faith-based, community-based organizations, tribes, and tribal organizations. But I want to caution you that you want to refer to your specific NOFO for eligibility information.
Wonderful. So can individuals apply or only institutions?
We do not fund individuals, only institutions that the PIs are attached to. So it's institutional funding that we provide. So let me take this one step further. I know this isn't a question, but by extension, we have gotten this question in the past. So since we only fund institutions, should a PI who's attached to that institution move to another institution, that PI cannot take that award with them and move it to another institution without the permission of the institution that received the award, right? So it's institution awarded.
So there's a question about what types of awards do you offer? Cooperative agreements, grants, or contracts?
So at this time, we don't offer contracts, only cooperative agreements and grants. And so the cooperative agreements are for our research networks and our single investigator innovation programs. And we have 2 right now that are autism-based. And our grants are second for the SDARS, the Secondary Data Analysis Research Program, and the Field-Initiated Innovation Research Studies. So we've got 2 programs that are cooperative agreements and 2 programs that are grants. No contracts as of yet. Now, the difference between the 2, so with cooperative agreements, substantial involvement is expected between HRSA and the recipient during the project period, meaning that your project officer will be working closely with the PI on sort of driving the implementation of the project and direction. Unlike a grant where we monitor to ensure that you're implementing your project as planned within timelines and so on. So there is more involvement with a cooperative agreement than there is with a grant.
Let's see, how do you determine who gets funded? Do you have a cutoff score?
Cutoff scores. No, we do not have cutoff scores. So as I presented earlier, funding decisions are based on a number of factors, right? But one of them is scientific merit as determined by the external review committee. And also the other factor is the availability of funds. So, you know, based on the number of projects we can support in a fiscal year, we fund down the rank order list.
Wonderful. Okay, and then there is a question, is this a recorded session? Are PowerPoint slides available? Yes, so I can answer that one. An archive of our webinar today will be available on the Division of Research website in several weeks, so please take a look there. And it also has archived our previous EnRICH webinar of topics that you might find interesting. Okay. Monitoring the chat. So please continue to submit your questions, and if we aren't able, please still feel free to submit them through the Q&A field, and we will respond to you after today's webinar. Okay. So thank you so much again, Dr. Eva Assing-Murray, for such a great presentation today and for sharing your wisdom with us. So again, please send your questions through, and we will follow up with you and respond after the webinar. So as we're nearing the end of our program today, after this webinar, everyone will receive a request to complete an evaluation. We hope you will fill it out and provide our division with feedback on the event today. Your responses will help us plan future webinars in the EnRICH series. So as I mentioned at the start, this presentation is the first webinar of a series that will focus on MCHB, OER, DOR grants. So please stay tuned and check on our website and our listserv. Sign up, as Dr. Assing-Murray mentioned during her presentation, for additional details. So thanks, everyone, for your attendance and participation today. And again, thank you, Dr. Assing-Murray. I also want to thank Kara Wise and Hallie Doggett at Alterum for helping organize this great event. And thanks, everyone, for joining, and have a wonderful afternoon.
Okay. Bye-bye.